This is the last lecture of most common cases in physical therapy. The topic I will discuss here is the taping techniques. We discuss all regions taping. Here I will discuss it in briefly. Next we will discuss the complete playlist of kinesiology taping. First we have shoulder taping. Shoulder taping may be beneficial following certain shoulder conditions or injuries, such as AC joint sprain or shoulder dislocation. We can use taping, or during sports or other activities that increase the risk of injury or aggravation. Begin this taping technique. Patient or athlete should have in a good posture with the hand placed on the hip. Place a strip of a tape around the upper arm, keeping the biceps tense, and strip of tape from the shoulder blade to the chest. The direction that are shown here, you can see the black arrows. Here the direction of using the tape. This should be applied gently to prevent circulatory problems because blood flow should continue. Flow should not be interrupted when using or applying a tape. It is used as a fixation point for the other shoulder taping techniques. This you can see in the figure 2. Here is the direction of a shoulder taping. Next we have straight lines. Begin this taping technique in good posture with the hand placed on the hip. Start the tape at the level of the upper arm, ensure at the side of the arm by following the black arrows. You can see here the black arrows that are directed upward. Conclude this taping technique by firmly following the white arrows. We can start from here and we can end it at white arrows. Do 1 to 3 straight lines depending upon the amount of support required. If more support required, we can use more tape, with each additional line partially overlapping the previous line. This is the straight line taping. Next we have shoulder crosses. Begin this taping technique in the good posture as we discussed this before, with the hand position on the hip. Start the tape at the level of the upper arm, ensure at the side of the arm by following the black tape and at the white tape. 2 lines of a tape should be using following a cross. This is the cross taping, so we make it a cross. Do 1 to 2 cross depending upon the amount of support required. Shoulder crosses, you can see here, this is the straight line in the pictorial form and this is the shoulder crosses. Next we have done with the shoulder taping, straight and the crosses, and next we have elbow taping. It may be beneficial following certain injuries such as the medial collateral ligament tear of the elbow. Taping can be used to provide stability to the joint to prevent injury or recurrence. We can use taping, keeping the elbow in a slight bend position. Tape around the upper arm and the forearm just above and below the elbow. You can see here, not on the cubital fossa, it's on the above and below. Keep the arm and forearm muscle contracting during the process and apply the tape gently to prevent circulatory problem. Anchors are used as a fixation point for other taping techniques. Medial crosses, it has also medial crosses technique. Keeping the elbow in a slight bend 30 degrees, start the tape at the level of the arm, anchor on the inner side aspect of the elbow by following the black. You can see here, this is the medial crosses. Conclude this taping technique at the level of the forearm by firmly following the white arrows. 3 pieces of tape should be used forming a cross. You can see here, this is the medial crosses. The wrist taping, we have wrist taping may be beneficial in the sprains to prevent injury or injury aggravation. Place a strip of tape around the palm of the hand just below the four fingers and the strip of tape around the forearm just below the wrist. You can apply this. This should be applied gently to prevent circulatory problems. Always remember, and it is used as a fixation point for the other wrist taping techniques. Next, we have dorsal crosses. Keeping the wrist in a neutral position about 30 degrees, start the tape at the level of the forearm, anchor on the back of the wrist by following the black arrows. Conclude the tape at the white arrows. Piece of tape should be used following a cross because this is a dorsal crosses. The taping method should make a cross in this one beginning from the inner wrist and travel to the outer hand, and the other beginning from the outer wrist and travel to the inner hand. This can make a cross. Do 1 to 2 dorsal crosses depending upon the amount of support required. If more support required, we used more taping. This is the pictorial form of dorsal crosses. You can see here. Start from the black, end at the white, and this also start from the radial and end at the medial little finger. Medial side it will end. This can make a dorsal cross. This is on the dorsal side of the hand and it can make a cross. Thumb taping is beneficial in case of thumb sprain or to prevent any kind of injury. All indications and contraindications are same in case of taping. Place a strip of tape around the forearm just below the wrist. This should be applied gently to prevent circulatory problem and use as a fixation point for other taping techniques. Thumb taping, you can see here, this is the pictorial form. Second, in the thumb we have a side loop. Keeping the wrist and thumb in a neutral position, start the tape at the level of the anchor on the front of the wrist by following a black arrows, and it conclude on the white as we discussed this previously. Do 1 to 3 side loops slightly forward or backward of each other. Side looping, you can see here, starts at the black and it ends at the white. This can make this way. Side looping, and this is the front loop. Next we will discuss keeping the thumb and wrist in a neutral position backward slightly about 30 degrees. Start the tape at the level of the anchor on the front of the wrist by following the black arrows and it will end at the white. Do 1 to 3 front loops slightly forward or backward of each depending upon the sport required. It totally depends upon the sport. This is the front looping. Finger tapings. Now we have finger tapings may be beneficial in any kind of sprain injury or to prevent the injury. Place a strip of tape around the finger just above and below the affected joint. This should be applied gently to prevent circulatory problems, and this is the pictorial form of this finger taping. Side crossing. Finger in a neutral position, start at the level of the lower anchor at the side of the finger by following the black, and it also end at the white arrows. Do 1 to 2 side crossing at both the inner and the outer aspect of the finger. Slide forward or backward of each other depending upon the sport required. Side crossing. This is the pictorial form of a side crossing. Inner view. All the indications, contraindications and the considerations for applying taping is the same. You have a good idea now. Posture taping. The following posture taping technique may be used to provide support of the upper back, neck and to improve the Posture. Begin starting or standing in a good posture. Your spine should be straight with your shoulder, back and chin at the level. Eyes looking forward. Place a strip of tape along the top of the shoulder and across the top of the lower back. This can be used as a fixation point for the other taping techniques. You can stand like this, and this is the taping techniques for the posture. Posture taping technique. In the posture we have used vertical lines and also use back taping for this. In the vertical lines, maintain the spine in optimal posture. Begin this taping technique at the level of the top anchor by following the black lines, and it should also end with the white lines. Create 3 straight lines. You can see from upper end to a lower end. You can start. Create 3 straight lines with the middle line in the center of the spine. You can see the middle tape is at the spinous process of vertebrae. Back taping. Back taping may be beneficial in case of lumbar disc bulge, where forward bending activities may aggravate the injury. You can use in a lumbar disc prolapse or bulge. This you can see it is in a vertical, horizontal strip of tapes and the vertical lines. Horizontal, it is along the lower back, and another one across the top of the pelvis. You can see it is at the top of the pelvis. They are used as a fixation point for other taping techniques. Vertical lines, you can see, maintain the spine in optimal posture, either laying face down or in standing. Begin this taping technique by following the black arrows, and it should end at the start from a outside to top to bottom. You can see this is the technique of applying this. Create 3 straight vertical lines with the middle line in the center of the spine. You can see the middle taping is at the spinous process. Knee taping. Knee taping is also beneficial in case of knee sprains, injuries or injury prevention. Begin this taping technique. Knee is in a slightly bent position about 30 degrees and the thigh muscles contracted. Place a strip of tape around the top of the lower leg and bottom of the thigh as demonstrated. You can see here is the taping and here is the taping you can apply. Prevent any kind of circulatory problems, and it is used as a fixation point for the other taping techniques. In the knee we have a medial crosses. Keeping the knee in a slight bend position, start the tape at the level of the lower leg, anchor on the inner side of the knee by following black arrow, and it should be end at the white. This is the medial crosses. You can see start from the black and at the white. This can make a cross at the medial side. Patella taping. It Patella taping is also beneficial in case of patellofemoral pain syndrome. Taping is also used in musculoskeletal injuries. If you have any musculoskeletal injuries, in mostly athletes, the taping we can use to prevent or recurrence of injury and to avoid excessive instability. Begin laying on your back with the knees slightly bent but completely relaxed and a foam or a roller under the knee. Start the tape in line with middle of the kneecap at the outer aspect of the knee. Use your thumb on the top of the sports tape. Gently push the kneecap towards the inner aspect of the knee. This is the pictorial form of the knee taping, patella taping. You can see taping is applied in this direction to this direction. It start from the skin at the inner aspect of the knee towards the kneecap. Finish this taping technique at the inner aspect of the knee. Start from the lateral side and end at the inner side. Repeat this process 1 to 3 times depending upon the amount of support required. This is the patella taping, and this is the done with the patella taping. You can see here this we can do in case of patellofemoral pain syndrome. Achilles tendon taping, it may be beneficial following in case of Achilles tendon or tendinopathy. In case of calf strain, calf muscles are soleus and gastrocnemius, we can apply here anterior ankle impingement or to prevent any kind of injury. This is the position you can apply the taping here and to prevent any kind of circulatory problems. Next we have straight lines, keeping the foot and ankle in a neutral position. Start the taping at the level of the lower leg anchor. Begin this taping technique by following the black lines and end at the white lines. All the instructions are the same. You can see more taping are applied if more support required. Ankle taping is beneficial in case of ankle injuries during activities that aggravate the patient pain or to prevent any kind of injury. This you can see here, avoid any kind of circulatory problems. All the same things are describing again and again. Stirrups, keeping the foot and ankle in a neutral position. Start the taping at the inner aspect of the ankle and the lower leg. Begin the tape technique by following the black arrow and the end at the white arrows. Don't stirrup, just slightly forward and backward of each other depending upon the support required. This is the stirrup. You can see this can apply in this way. From the medial side it start and the lateral side it end at the white arrow. Figure of 6. Keeping the foot and ankle in a neutral position, start the tape at the level of the ankle on the inner aspect of the ankle and the lower leg. Begin the taping technique by following the black and end at the white arrow. Figure of 6, slightly forward and backward of each other depending upon the amount of support required. This is the figure of 6 taping. You can see it start from the medial side and it end at this way, forward to the ankle joint. This you can see at the ankle joint strip, and this is the figure of 6. This is the taping techniques you can apply, and this is the last lecture of common cases in physical therapy. Next we will start with more new and amazing playlist. I hope so you like this video. Thank you.